All right, Spine Gang, welcome back to the Accordo Chiropractic podcast. I am here with a very special guest, Dr. Averia, who those of you who have been with the practice for a while, especially during Dr. Dupree's maternity leave, you already very much know Dr. Averia, but we are super excited because we are about to embark on a really cool new adventure here at the practice. We are finally launching Active Care. And I am 10 out of 10 pumped because having an active care component to the practice has been something that I've wanted to really add for so many years here. And the reason why is because it's been such a valuable asset for me personally in my own journey of recovery after horrific, low back disc herniations, being unable to move. The chiropractic was the pivotal change that I made. But in addition to that, the vital component of relearning and retraining all of these broken biomechanical habits that I had that I didn't even know I had have really helped me be fully functional in my own body in the way that brings me joy on a daily basis. And we're launching in September, and I am 10 out of 10 pumped. So, Dr. Averia, tell us about yourself. Like, what got you into chiropractic care? And specifically, like, why do you want to do active care?
Thank you, Dr. Marco, for having me here. This is super exciting for me. It's something new. We've done active care throughout my practices in the past. I've been a chiropractor for about 14 years now, and it shows up in different ways with the cervical spine and the thoracic spine and the lumbar spine, doing exercises for those, active exercises for those before getting adjusted and things like that. I've just seen the benefits, really. In the past, and for me personally, I was a student athlete. I love to move like you do. I think it helps me show up as well, like just fully, and I feel happier to be able to do the things that I want to do in life, especially postpartum. I've also had my own injuries with lower back, and few people know this about me, but used to do like martial arts for about 10 years. So I've had some injuries there to recover from. And I'm just very excited to get to do something new to be able to help people in a way that I've been helped. Yeah.
Awesome. So we got to hear about the martial arts.
Okay. I would love to tell you about that.
Tell me everything.
Okay. I used to train capoeira in Atlanta after I graduated from Life. I met this wonderful group of people. We were part of Cordal de Ouro. It was Brazilian martial arts, or it is, and our mestre and his wife were amazing people, and I was training like 6 days a week. I was dancing samba. We would go to events together, travel together, and just perform and learn and really embrace the capoeira culture. It was a lot of fun. Yeah. But I injured myself performing one of the moves.
Yes.
Yeah.
So, what happened? And I need to hear the whole story on that one.
Oh, so it's a basic movement. You kind of hold yourself up on your side. It's called queda-de-rins, and you kind of, your legs and your knees are up, and you're balancing just on your hands on the ground like that. Whoa. I know. Could I do that now? Maybe a little bit. Yeah, I have to get back to that. But my elbow slipped behind me, and my shoulder moved forward. And maybe people don't have like that kind of a mechanism of injury to their shoulders, but I know there's a lot of people with shoulder injuries and restricted shoulder movements and things like that will be able to help too.
Yeah, so, for sure. So after the injury, like what happened? Like what were you not able to do? Like, yeah. Tell me about like the injury itself.
So I had a lot of pain raising my arm, like above my head, doing anything overhead, performing those movements that were kind of crucial to like the martial art. And I mean, I was so thankful to, at that time, be in chiropractic school to get adjusted and get some help there, which is where I was introduced to physiotherapies that were designed to help improve the shoulder. And I just knew, like, from that point, at some point, like, I wanted to be kind of enmeshed in that world.
Yeah.
Yeah.
So that must have affected your ability to, like, deliver adjustments.
Yeah, for sure.
Because, like,
yeah.
You guys might not know this, but, like, the number one reason why doctors of chiropractic go out on disability or retired from disability is because of shoulder injuries.
Right.
Because we're using our shoulders all day,
Right.
every day. And a shoulder injury can really put you out.
Right. Yeah.
But you recovered.
Yeah. Yeah. And I'll say sometimes I have a little when I do some shoulder work. I have some little neck pain here and there, but like chiropractic and exercises and things, manual therapies have helped me like stay, I'm pain free, but
Yeah.
help me continue.
For sure.
Yeah.
So what really drives you and what inspires you to really explore active care as this new adventure for you? Like, what's really the source there?
It's a great question. I think it changes like different phases of life I'm in. So probably the driving source right now is just like, I like to practice and kind of just, I think practice reflects like the life phase that I'm in right now. So just being able to like go out and run without pain and go out and like lift my kids and play with them and get down on the ground and just like maintain like just the physical ability to be able to see a lot of patients during the day and things like that. I think that drives me. Also, seeing my parents age has really affected me lately. I hope they don't watch this because I don't want them to think that they're very old. And but yeah, I kind of want to like live till I'm 100 or 300, as my dad says. And, I'll see a lot of people like who age and, we'll have a lot of things that we encounter in life, but not moving well is not going to be one of them for me.
Yeah, I love that. So like you said, our practice oftentimes reflects like our stage of life, and like maybe in our 20s, the objective is like, maximizing performance, right? But you're a mom.
Right.
And you're a wife.
Right.
And we're not in our 20s anymore.
Nope.
And so the priority has started to shift.
Right.
And the priority, it becomes fulfillment, longevity, and ability to just do what you want to do and be an active, participant, like main character in your life without these physical limitations that seem to be like really in a profoundly negative way, like really impacting so many people in our age. You are an amazing doctor.
Thank you.
Everybody that meets you knows it immediately. And you currently in the past in Hampton Roads have done a tremendous amount of coverage work for a lot of other practices.
Yeah.
So based on your skill, ability, your experience, my imagination would tell me that every single chiropractor you've ever covered for wants you as, a full-time member of their team beyond the shadow of a doubt.
That is a very strong compliment, and thank you for that.
And it's true. So what makes you want to be a part of the Accordo chiropractic team?
Well, this one's easy. After covering here, I just love the team environment. I've always loved working in a team. It's just the way I am, I guess. Working on my own is a lot of fun, and but it can get lonely at times. And just the energy here at this practice, just the way your operations, the infrastructure that you have here. I don't, I just feel comfortable, and it feels like right at home.
That is a very strong compliment.
You're welcome.
Thank you. All right, so let's talk about active care. So we've said that word a lot of times.
Yep.
What is it? What does it mean? Because it's kind of like a Dr. Marco original, like just calling it active care, right? What is it?
Yeah, I was going to say, it's a Dr. Marco original. You tell us what it is.
Yeah, no problem. So active care is like the physical movement part of your healthcare routine. So chiropractic care, for the most part, when you're looking at just like straight adjustments or even manual therapies, that's very much passive care.
Right.
You're having things done to you. Now, these things activate parts within your body so that they can work better, and there's no literal passive care, right?
Right.
Because the body does the healing, right? The practitioner doesn't heal you.
Right.
We just provide the opportunity. But I've always known that what we're really missing as a culture is like understanding literally what our body needs from us to deliver to us its absolute best over an entire lifetime.
Right.
And so active care is really designed to help people move better so they can move better for a lifetime.
Okay.
Retraining muscle groups, reactivating muscle groups. And at the end of the day, we've got this amazing neurological approach that really sets us apart from PT. And when I say that, chiropractors are not bone doctors, right? We are not musculoskeletal doctors. Chiropractors are nervous system doctors. And so we look at problems through the lens of the nervous system, which is super effective because the nervous system, right, it's the master system of the body. It controls everything. So we have this neurological approach that looks like this. Phase one of active care is always going to be activation.
Right.
We all live these lives that are much more sedentary than humans have ever lived lives before. And we, sleep in a bed, which I love having a bed, right? Way better than the floor. But then we wake up and a lot of times we'll sit to have coffee or breakfast. And then we sit in the car for, on average, 20 minutes for our commute to then go sit. And if we're not sitting for work, we're doing these repetitive motions. We're walking around on hard level surfaces all day. And then after work, we go then sit in the car again, and we go home, we're sitting again.
Right.
And so neurologically, that systematically deactivates movement patterns that are essential for us to be able to move our bodies in a healthy way, long term. So the first thing we need to do with any kind of an active care protocol is always activate these dormant pathways.
Yeah, I think you're talking about the posterior chain, because we're sitting on our butts all day. And, like one of the first things that we're going to have people do is assess that, right? And check out the squats and see how we can help activate some glutes.
Activate some glutes. Yes, posterior chain.
Yeah.
So huge. The second part of active care is always going to look like stability.
Right.
When these pathways and these muscle systems, these movement patterns have been dormant for so long, we don't have the joint stability that we need to move throughout our day in a healthy way. And people will experience that with neck pain, shoulder issues, mid-back pain, low back pain, hip pain, knee pain, ankle pain, foot pain, you name it. We're not able to fully stabilize our skeleton in place. So we need to activate, which is going to be step 2. Step 3 in that process is to then strengthen. So once everything is active, once we've got a stable foundation, then we can start building muscle. Then we can start building strength, getting stronger, doing some movements where, people might not think like deadlift is going to apply to me, but it applies to everybody, right? Squats apply to everybody, lunges, all that stuff applies to everybody. Posterior chain applies to everybody. And then finally, the last thing we're going to do through this whole active care process is help mobilize. Build in that flexibility, build in that suppleness to the body. And I think that's the big difference between what we're doing and what would happen at a PT office. We can talk about what the active care patient journey is going to look like here.
Sure.
And I wanted to take what we do really well at Accordo Chiropractic and kind of extrapolate it to this active care. And one of the big things that I think we're really good at and always trying to get better at is education.
Yeah.
Education is so huge. So active care is always going to start with an initial movement assessment.
Right.
An educational, basically, exam where we can figure out, all right, how is this individual moving?
Right.
Right? Where are the deficits? and where do we need to start? Like,
Right.
where does this activation have to start? What's still asleep? What needs to get woken up? And after that initial movement assessment, we're looking at, a plan of care,
Yeah.
which is probably going to look somewhere between like 6 and 18 weeks at like 2 times a week. The nice thing about active care here is it's going to include an adjustment.
Right.
So vital to wake up that nervous system, start allowing things to be connected in the most right way. Some sort of a manual therapy to help with reforming and kind of breaking up scar tissue, muscle adhesions, allowing the body to move in the most natural, most biomechanically correct way. And then exercise
Right.
to rebuild that foundation. In terms of like that initial movement assessment, what does that look like? Like, what are you really looking for? What are the movement patterns that are super important for everybody on a daily basis?
If we take our squat example, what's important for the squat is that we're not leaning too far forward, or those are the types of things I'll be looking for, is like the forward leaning, or if your heels lift up from the ground, or if your knees are falling inward. That's another indicator that the glutes may be weak, or the hips are unlevel, or ankle mobility problems. So that's just one example of one of the assessments. We can do push assessments, carrying assessments, things, watching your posture. Carrying it could be very simply like a grip issue. So that would open the doors for other assessments, especially during that first initial examination or assessment. I probably have like 10 to 12 various assessments to go through and rule out pass, or this is something we need to further investigate and work on.
Yeah, so like with a squat, we're not talking about just like the person who's lifting weights in the gym.
Right. No. Yeah. You sit down on the chair and you go to the bathroom, and I heard that podcast that you did the last time with Jamie, the nurse practitioner, and talking about squat mechanisms and using the bathroom. But yeah, everyone needs to be doing squats for various reasons.
Yeah, just the like function of daily life. Like,
Absolutely.
you need to be able to do this to get up off the toilet.
Yes.
Right.
Yeah.
And functionally, right, now that I'm thinking about it, like we do a lot of squats throughout an entire day.
Right.
Right. Just getting up from any chair.
Right.
Getting out of a car.
Yes.
Wow.
Yeah.
Okay. So just in that squat assessment example, right, we're looking at feet, knees,
Yep.
ankles,
Right.
hips, the spine, the whole thing.
Absolutely. Yeah.
And that's just one body part.
That's just one assessment.
That's just one assessment.
Yeah.
Wow. Yeah. To circle back to that neurological approach to the care here, step one is activate. So we kind of talked about how everything goes to sleep, right? What does activation look like? Like, and what I'm asking is like, what's so different about the way that we can work with somebody to help activate something versus like maybe finding a YouTube video and just trying to like wing it yourself?
Yeah, I think cues have a lot to do with it. We talked about that. I think you had a patient here one day while I was covering, and she said, I leaned to the side a lot when I'm standing. And we talked about like spreading the floor with your feet. Well, she could do that right away. Stand up straight, no discomfort, engaging both glutes in that way. And so that's what I think of when I'm talking about activation, not traditionally your like, clamshell exercises or whatever, even though you probably will be doing those when you come here, but not that type of activation. And I also think a little bit about proprioception, which is a neurological word that we use sometimes in practice, and just like waking up the nervous system in that area, and you recognizing or you identifying where your body is in space, and you can adjust, and being able to move from that assessment to reach your goals. Activation is going to be like key to that.
Gotcha.
Yeah.
So for those of you guys who don't know, Proprioception means your body's ability to know where it is in space. So if I close my eyes, right, I can touch my fingertips together because proprioceptively my body knows where it is in space.
Right.
And that's a huge deficit for some people.
Yes.
And each body part has a different level of proprioception.
Right.
Right. So what I heard you say was that in terms of the activation, you've got these super clever cues that help people to fire muscle groups that haven't been fired through their normal learned biomechanical patterns that then wake up these biomechanical patterns that have been dormant for a really long time.
Yeah, absolutely.
Yeah, and then super crucial too is the chiropractic adjustment before that, because then now we're literally removing like mechanical interference from that nerve flow, and the two together is just bomb.
Right.
It's just bomb. Okay, awesome. So then in terms of the stability, right, what kinds of stability exercises, how do we kind of create stability in a system that's been very unstable and then also compensating?
Again, back to core that we talked about, we're going to focus on like isometric exercises, or just like
isometrics.
Yes,
okay.
You just, or those quadruped exercises and things that seem so simple, and would take you through, each of those exercises just to see if you can do it. Are you breathing correctly when you do it? Is your pelvis tilted the right way when you do it? We're giving you those cues again, belly button to the spine, chin tucked, and things like that. Like, are you using your we could talk about breathing in that way. Are you using your shoulders to breathe? Are you using your chest to breathe more? Are you, belly breathing? Like what's moving and what's not? Yeah.
So you talked about isometrics,
Right.
and isometric is basically you put your body into a position where
Right.
you're doing a muscle contraction, but the joint's not moving.
Right.
Yeah, super huge for stability.
Right.
For sure. And then you talked about core and these quadruped exercises. So quadruped, not trying to shame anybody, but what a quadruped exercise is basically being on all fours.
Right.
It's not an accident that children learn how to crawl before they learn how to walk.
Right.
Right. And then that crawling neurologically, biomechanically is super important to actually do before you walk.
Right.
Because it helps activate and stabilize the core.
Right.
Then what ends up happening is when there isn't joint stability, or even just we're looking at like a body system, like let's just talk about the low back, because it's not just one joint through there, right? Or the hip and the thigh, there's more joints than just the one.
Right.
When you don't have like these deep stability muscles that are firing because they've been deactivated for a long time, these other muscle groups start to try to take over.
Right.
And that's a huge problem, because the moving muscles that we're using on a daily basis to move, they're too big and they're too dumb to stabilize the joints.
Right.
So using the shoulder as an example, right, you're not going to have good biomechanics if your shoulder is stuck forward, out of the socket, and then we're wondering why we can't go overhead. Well, the shoulder's not in the right position.
Right. It's not stable.
It's not
It's
stable.
in an unstable position, right?
Absolutely.
So
And
reteaching those positions as well. Yeah.
through those isometrics.
Right.
That's awesome. So then once everything's stabilized, right, then we're looking at strengthening.
Right.
This is kind of one of the places that people kind of jump to first.
Oh, yeah. Yes.
Erroneously.
Yes.
So like you go like these couch to 5K programs, or, I just jumped into CrossFit.
Yeah. Well,
right?
even if you've been active before, it's so easy to do. It's so easy to skip the steps before and then just go right back into it. And the risk is injury. And
Yeah, especially for like the adult former athlete.
Right.
Because we've got this like idea in our head, we're just going to get back into the gym and just get strong again.
Right.
But we're not living in the same body.
And we're not doing the same things every day.
Right.
We're not running for 2 hours in the afternoon at practice. Yeah.
So strengthening, super important, but at the right time.
Right.
Awesome. And then the other part where people just like love to jump right into is the mobility, flexibility piece of this thing. Right. So I just had a Instagram reel the other day. We were talking about yoga potentially being not awesome for you, because we're jumping right into this flexibility component. And I'm not saying that yoga is the problem here. I think it's the way that a lot of people in our country approach yoga, as if it's this like flexibility routine, right? But it's really a stability routine. And then after you've got the stability and the strength, then you can safely, right, move into mobility.
Right.
So in terms of the strength component, you know, what kinds of things have you devised? What does the strength component of the active care look like?
Yeah. Like you said, before you can move on and you're stabilizing, like, for example, like improving someone's balance is going to help tremendously. When they're doing single leg activities or even standing on 2 feet, you can't add that load until there's some stability there. And I think that's what you're asking.
Yeah, but once the stability is achieved and we're actually working towards the strength component,
right.
like what types of things are we going to be doing to help people get strong?
Take this weight, carry it across the room and carry it back. Add this weight to your back and squat down the best you can with the cues and the ways that you've learned here. No, seriously, the way that I've been thinking about this, and maybe this is a good reason why we're talking about this right now, is just like once we get there, you've kind of like passed, you know, what we have, you've kind of reached your goals that you set out in the beginning. You're probably back to your normal activity and your normal routine, pain-free and things like that. So you can start doing the things that you want to do and do them more, adding on the weights, adding on, you know, like just deepening your normal routines. Yeah.
Nice.
Yeah.
So, you know, grabbing the weights and carrying them across the floor, that's pretty important, right? Daily basis. Like I'm a one load grocery kind of guy.
Yeah.
Right?
Oh yeah. One time out of the car. Yeah.
One trip with the grocery bags, but you know, you want to be able to do a farmer's carry with like, you know, 50s on each side or whatever that might be. Adding some weight to your squats, being able to deadlift, adding some weight to that deadlift, you know, putting some plates on the bar and let's see what we can do.
Yes, that is going to be happening here.
Yeah. Super exciting. And then in terms of the mobility component, you had mentioned a lot of amazing points about like thoracic spine mobility, hip mobility. What does that kind of look like, you know, within the program?
I think that we'll probably be implementing a lot of use with the like bands and things to improve. Like we talked about if someone had a shoulder problem. A lot of times I think it's as simple as like, you know, squeezing your shoulder blades together in different positions to try to strengthen the back, stretching the pectoralis muscles out. Sorry, I don't know why I said that like that. Pectoralis muscles. Reminding people that, like, you know, we have a back and it's there to extend and improve the motion there, and not just be stiff and still. Yeah.
Beyond posterior chain, core weakness, where else do you see some major deficits where you can help?
I would say hip mobility, that's huge right now. And that goes along with everything else we were talking about. Shoulder mobility, a lot of people think that like it's just my shoulder, it's just here, when it could be like how your scapulas are moving, how your thoracic spine is working. I mean, I actually think that's pretty big and huge, and we're a missed opportunity for a lot of offices. I think a lot of time we focus on like neck and low back and stabilizing those, but is the mid back moving? Like that should always be able to move. You should be able to twist and turn and things like that, and squeeze your blades together. And I think that's a missed opportunity. But yeah.
And you also mentioned the hip mobility.
Oh yeah.
So when the hip's not mobile, like what's the problem there?
It could be anything. You could have like ankle mobility issues, knee issues as well. I mean, you could have different levels of pathology in the hip that we could assess for, but very basically you could also just need some cues on how to breathe correctly or squeeze your glutes when you're doing certain activities that make the hips feel better. So if we give you cues and that works, that's great. If the cues don't work, then there's something else to look for.
Look a little bit deeper. Yeah. I find a lot that if the hip doesn't move the right way, then there's a lot more movement that gets transferred to the low back.
Absolutely.
So like in a squat is probably a really good example here. Like if the hip can't move, right, then that motion to get into a deeper squat then transmits to the low back.
Right.
And then it puts the low back in a position that it's not going to be strong in.
Right.
You know what I mean?
Yeah.
Because for the spine to be strong, it needs to be in a neutral position, right? That's where the biggest amount of strength is going to be. And I'm not saying the low back shouldn't be able to flex and bend and move. But what I am saying is that if you're going to load it up with a lot of weight, it needs to be in a neutral configuration to have the best strength. But if your hip can't move into position, then the low back starts compensating. And that's where a lot of people get into some serious issues with like low back herniations. And then, there's just a cascade of issues from there. But you mentioned mid-back as well. And I want to hang out there for a minute because people think about like having good posture.
Right.
And so much of that comes from the mid-back, especially when you're talking about like forward head carriage, right? Somebody, caught in this like hyper-flexed mid-back position where the mid-back literally just can't extend. You're not going to have good neck posture.
Right.
There's just no way.
Right.
Because your mid-back is curved forward, right? So that's going to jut your head and neck out into like this forward direction. But without that mid-back flexibility, without the ability to actually move that mid-back, that's never going to change.
Right. And I mean, we always tell people as well, like if you are you not moving in one spot, then there's hypermobility above and below that. So like you might be experiencing a lot of movement, popping and clicking or whatever going on in the neck or the lower back, but that's not going to change if the mid back is not moving well.
To get back to some key differences, 50 minutes one-on-one with the doctor. I'm pumped that you had an amazing experience with your postpartum PT, which is awesome. Like you said, those niches,
it was so different.
They get it together. I've been to PT a bunch of times.
Yeah.
I was in the Army, injured my knee, and so you go to PT, right?
Yeah. And
it was the very typical, like, you come in, right, you fill out the forms, and then they stick you on some sort of a bike or a treadmill, and you warm up for, like, 20 minutes or whatever, like
you get stem, your muscle stem maybe.
I didn't get any muscle stem.
Oh, that's unfortunate.
No, so I sat there on the bike for a while, and then the PT comes over. I get a list of exercises, and then I'm kind of like set off on my own.
Yeah.
To like do these exercises, and then we measured some range of motion, and then like when I could do this X, Y, Z, and thing, then I was like cut loose.
Yeah, they had a lot of people to see.
Yes, they did.
Yeah, they couldn't watch you.
They couldn't watch me. And so a lot of times you're working with a PT assistant, not even working with the doctor. And I know that just from speaking to PTs that are forced to practice in that kind of environment, that's not how they want to practice.
Sure.
Either. And a lot of that is very insurance reimbursement driven, right? Because like, let's say the PT appointment costs, let's just use crazy numbers. Let's say it costs $1,000. The insurance might reimburse them $25.
Yes.
So then the only way to make up that deficit is then, unfortunately, volume.
Right.
And the PT assistant's way less expensive to hire, train, than the PT that has that level of like expertise, experience. But they don't want to be practicing that way either.
Right.
They want to deliver that very personalized, one-on-one focused care.
Right.
But I'm really excited that we're going to be able to be delivering that here in the way that people most need.
It gives us a lot of flexibility to do what we can do, and especially with an hour, like we're going to have a lot of flexibility to like help people. So in the way that need to be helped.
Yeah.
Yeah.
The other thing that I'm really excited to offer is wellness care, which I've never really seen implemented in a PT setting. Mm-hmm. But it's so crucial, right? Let's say you've got like, 8 weeks of this dedicated, 2 times a week, 50 minutes working with the doctor. And then after that 8 weeks, you don't do anything.
Yeah. You go back to your old habits, or potentially you don't, like you said, you don't do anything, or maybe you just go back to training the way you're used to. It's really helpful to have a coach or someone there in your corner to keep you focused on exactly what you're supposed to be doing.
Focused, accountable.
Yeah.
So for our wellness patients who are here anyway once a week, I just figure, we're here anyway.
Right.
Let's do a few things and keep everything active. Let's keep everything mobile. Let's keep the axe really sharp.
Right.
So that we can be as healthy as humanly possible.
Absolutely.
Forward.
Yeah, you have a pretty active practice. I like that too about this practice. I think you inspire a lot of people to get moving, for sure.
Well, thanks, Doc.
You're welcome.
That's the idea. Yeah. A rolling stone gathers no moss.
Yeah. It's good leadership. Yeah. You're helping others help themselves.
Also a strong compliment.
You're welcome.
Yeah, thank you. Ultimately, we are getting ready here to launch in September. And we do have limited availability because, again, this is one-on-one right with Dr. Averia, super exclusive. So throughout the month of August, we're going to be offering this to our existing patients only. So if you're new here, sorry, we definitely have openings on the chiropractic side, and we can talk about implementing the active care when it's appropriate for you. But for our existing patients who are already here, getting adjusted regularly, we are going to have this available. So if you are interested in having a conversation or finding out how active care can really help you out, either talk to myself or Dr. Dupree. In the meantime, we can get you on the short list, and then we can get you started. Live higher.